It's very important to make sure that whoever does this type of procedure for you has been through a lot of experience. There are a lot of different courses out there. There are lots of different ways to learn this skill set. And so it really does matter. Not all courses are created equal, and not all educations are the same, and not all experiences, good, bad, and indifferent, are the same for every clinician. It's extremely important because if you haven't had difficult cases and you haven't faced difficult situations, you just haven't been doing it long enough. Those of us that have been doing it, and I've been placing implants now for 13 years, there are definitely some very challenging situations that I've been faced with in the past, and the experience and the knowledge that I gained from those situations has just made everything better for myself and for my team and for my patients moving forward. So I did a one-year residency program, the Comprehensive Implant Residency Program out of Bessemer, Alabama with Dr. Michael McCracken. And it was an incredibly comprehensive course. It took over 12 months to complete. Not only was I in there, there was 8 or 10 other providers, and we would spend our long weekends preparing for the surgeries we were going to do. We would present the situation to the class. Then the next day we would go in and we would do the surgeries, and all of this is documented the entire time with photographs in the pre-plan, the photographs during the surgery, and then post-operatively. And then we would present what happened the day before on our final day. And so not only was I learning from the surgeries that I did, I was also learning from 16 to 20 other surgeries every single weekend. It was an incredible experience, and one that I really place a lot of value in. There's a lot of different programs out there. This one was particularly perfect for me because I was able to see my results over the course of the year with the same patients that I started treating. But I've also continued on with my continuing education in so many ways to better my skills and to better my technology and to make it ultimately a much better position for the patient to be in. I think one of the most important things that patients should look for in finding the right provider to place their implants, it comes down to technology. Does the doctor have a CT scan? Are they equipped to be able to do that? How many implants does the doctor place on an annual basis? What kinds of cases are they doing? Are they doing single implants? Are they doing onesies and twosies? Are they doing full arch reconstruction? What are the types of procedures that dentist is comfortable providing? It's not so much about a very specific course or certification or anything like that. A lot of those are, almost all of them are very acceptable, but there really is a big difference between what a piece of paper says or doesn't say and what they're doing and seeing and how they're treating their patients on a daily basis, how long they've done it, what types of procedures they're comfortable performing, and ultimately that they feel comfortable and that they feel confident with that provider, knowing that they have the experience on the easy cases and the mediocre cases and on the very difficult cases. So I think it's fair game to ask the provider, hey, what types of things can happen here? What types of things can go wrong? Don't worry about it. Don't lose sleep over, but just, make sure that your dentist is comfortable with those types of procedures and knows how to manage a complication if that does happen. For more information on Premier Dental Center, please give us a call.